Hi, everyone. We have kind of a critical mass, so I think we'll get started. Welcome to the first equity working group of the year. So this is virtual only, which yay is great. We won't be making any decisions today, but we are going to learn some really important things and going to be having some discussion. So I am going to pull up the slide deck. And actually, Jamie, if you have it in you, do you mind sending a link to the packet? Okay, hold on one second. I have so many things open. Let's just get the right one. Okay. All right, so first just making sure we're all in the same place where y'all know where we are. This is actually Equity Committee Working Group. I just want to do quick introductions, and I think the group is actually small enough, and I'll stop share for a minute. So this committee has some official members from the Council on Homelessness, which are Hope, Iman, Leslie, hold on, also Janae and Juno, and Juno and Janae are not here at this moment, but are there other folks here that want to introduce themselves? If you don't all, you guys actually probably all know each other, I think. Rachel, do you know all the people here?
I think I more or less do. I'm just looking quickly, but I'll turn my camera on for a minute. I'm just at the library, but hi.
Hi.
Library surprise.
Do you want to introduce yourself?
Okay. Rachel Rosekind, community member, just very interested in equity and space, and happy to be here.
So good to have you. Yeah, Rachel's been really involved, attended almost all the meetings last year. So really glad to have you.
Rachel, are you hanging out at the library or do you work at the library?
I hang out a lot at libraries, but I'm also on the library commission and do a lot of consulting and workshops in libraries for libraries. Yeah.
Big fan of the libraries. I just recently got my Contra Costa library card and my Richmond library card, so I could do both.
Amazing.
Yay.
That's awesome. Good for you. So glad to hear that. Yes.
I use my library card every day to listen to books. Yay. Excellent. Anybody else want to do a formal introduction of yourselves? You're welcome to if you want to. And if not, it's okay.
That was just directed at the working group members, but since I'm here presenting today, I'll go ahead and introduce myself, Mary Juarez Fitzgerald, and I'm the coordinated entry manager here with. So I'm going to be doing a little presentation for you all.
Great. Thank you, Mary. I can't remember who knows who when it's a group this small.
Totally fair. And I will just say, my name's Hope, and I am the community member representative on the council, and I work at Contra Costa College as their first basic needs coordinator.
Thank you. Why don't we have everybody introduced if we're going to do it? Iman, I'll pick on you.
Good afternoon, everybody. Iman Novin. I'm president of Novin Development. We're a Contra Costa-based affordable housing developer. I'm an affordable housing seat on the Council on Homelessness, and very excited to be on this committee this year.
Glad to have you. Leslie, do you want to introduce yourself if you can?
Yes. Hi, I'm Leslie Gleason. I'm with Trinity Center. I'm multitasking. And I've been on the council for a couple of terms now, and this work on the equity committee is really important to me. Thank you.
Thank you. Joe and then Jamie.
Hi, everyone. Joe Bruno, peer support specialist with Delta Peers and lived experience advisor on the council.
Thanks.
Hi, everyone. Jamie Schechter, homeless services chief with Health, Housing, and Homeless Services from Contra Costa Health. Good to see you all.
All right. I am going to jump through a few things. So I posted the minutes from our last official committee meeting with the packet in case anybody is curious. We're not doing like an official approval or anything, just wanted to create a tiny bit of space in case anybody had questions, comments, anything you wanted to flag about that. Okay. The next thing I wanted to check in with this group about, okay, let me make sure I'm recording. Yes, I think I am recording. So We, as part of our equity work plan for this year, we've kind of broken things into 3 sections. Excuse me, a learn section, an input section, and monitor. And the input and monitor is a little bit driven by what's happening in our system of care in terms of like when we bring you things for input and monitoring. But the learn section is really, really up to the committee in terms of what you all want to know. Some of the things you'll see today, like there's some work that we're doing as staff to think about if we know some stuff is going to come to you later, we're going to want to go through, teach you some of the nuts and bolts of whatever the thing is you're going to ask to be provide input on. But other things are really kind of up to you. So I'm just showing you what has been discussed so far. And we could probably do like 2 learn sections per meeting. Like today, I actually think we're going to do 3. But these are kind of the buckets that things have fallen into. And I want to just show these to you, see if you have other things that you want to learn or any refinement you want to make at this, make to this, because as staff, we'll be pulling together like speakers and information for you all. So I know reentry for sure is a topic of interest. So we're going to have some conversation today about like the homeless reentry interface. And then Nicole Green, who is our reentry seat on the council, is going to be providing a more comprehensive reentry 101 in May. There have been questions sort of around like funding, like the different kinds of funding that happen in our system of care, and then a little more specifically about Measure X. And again, just thinking about like with an equity lens, sort of like where can the council, you know, have input or influence around like equity issues relating to these things. Broad system stuff. So today you're actually going to get a coordinated entry 101 from Mary, which I'm super excited about, so that everybody has a level playing field to understand actually like when we talk about the system or coordinated entry and ways that we could think about it in terms of the equity so that you all have a basic understanding. In the future, there's going to be a revamp to the housing assessment tool or the VI SPDAT. So that's going to be coming later in the year, but at some point we're going to be bringing information to you like about that and talking about equity issues. And then some folks have said like they kind of want to understand population specific needs and what the system is doing to meet those needs. I would love to drill down on that further to get like a better idea of what that might look like. We also will do a review of kind of where we are on the equity assessment that was done a couple of years ago that helped lead to the formation, excuse me, of this committee. So we kind of have that built in. Another request was supporting people with lived experience in civic participation. And I'm curious to talk more about that and how that actually, how that fits in with the equity committee and kind of their scope of work. Data. So we're going to talk some about the annual report. And again, thinking about like, where are places where this group could have input, provide guidance on things they might want to see or how to use this. Unsheltered dashboard. So you'll learn more about that later this year. We can do some about like HMIS, which is where all the data is gathered. So like, what are the questions that get asked? What does HUD tell us we have to do? What are some of the data standards? And then like, how do we as a system look at performance? So that's a lot of information, a lot of options, but want to leave some space to hear what you all, especially, oh, dang it, especially the committee members, like what are there other things that you feel like you want to learn about over this next year to help set you up to better think about equity and our system of care, all the things?
This is Joe. Under the advocacy part, youth, I feel should be part of that discussion.
Mhm.
Are you putting youth in people with lived experience, or do we want a specific youth foster care that, because I know that's been an ongoing discussion too.
Yeah, we could do sort of in the same way that we're sort of doing a reentry 101, we could do sort of a deeper dive into like so let me propose this, like what the youth services look like in our system of care, but also like the foster youth system and how that connects with the homeless system of care. Is that what you're thinking?
Totally. I mean,
Okay.
that's, yeah, absolutely.
Okay. Yep, that's definitely something we could do.
This is Iman. I'm interested in sort of understanding just our current best practices and areas for improvement
Mm,
across
Mhm.
our various committees and work that we currently do. So I know there was a report that we had commissioned that got into a lot of that. But a lot of the data and maps and stuff was a little bit obscure and hard to
Mm.
follow. So
mhm.
breaking that down into, equity 101, here's what we do well, and here's where we would like to improve.
Mm-hmm. Yeah, so thank you, Iman. So yes, there was a very detailed equity assessment that we had conducted now, I don't even know how many years ago. I think it was finally done in like 2021. Is that right, Jamie?
It was
2020?
presented to the council January 2022, kind of right before.
Okay, yeah, I'm like, it's all a blur. But one of the things that was really complicated about that is there were, I don't know, over 50 suggestions, and some were very specific and some were very broad. But we could definitely sort of review what came out of that and see where we are. One of the things that would be helpful for me too is if you have feelings about which stuff you'd like to have sooner rather than later. So, would that be useful to have in May, for example, which is our next meeting, to kind of get a better grasp on like the big picture of where we are, where this work fits in. And I'll also mention we did a recap of this towards the end of last year, so I can also provide some information from that presentation last year. Yeah, Rachel.
Two things. One in relation to timing. I was just thinking the supporting people with lived experience and civic participation might have good synergy with the setup of the Lived Experience Advisory Board for the Office of Racial Equity and Social Justice, which that mapping that's gonna be done kind of over the summer. The plan is to do it over the summer. So that might, as you're kind of thinking around your timing of these different topics, that might be a good time to do this topic on your end, to see if you can kind of use some of that from them. And then the other thing I was just going to ask too is whether all learn topics should be, and it's totally fine if this is the case, but I just want to ask if they should be specific to Contra Costa County. So like, for example, there are some really innovative and exemplary guaranteed income pilots in our region and elsewhere, Denver, et cetera, supporting specifically unhoused or housing insecure community members. And a lot of them are now coming out with reports and outcomes and really amazing findings. So it could be something that could be a valuable learning topic and even a potential like advocacy piece for the council in the future.
So you raise a really good question, Rachel, or like reminder, which is, and this is what keeps happening to me around equity in general. It's like, it's so vast that I'm always trying to figure out like, where are the perimeters of what the council can focus on or has like sort of authority over. And so one of the things I'm thinking is the Council on Homelessness like is a little bit limited in terms of the advocacy they can do. They are an advisory board to the Board of Supervisors. So pretty much like they can provide recommendations or information to the board around like, we would encourage the board to explore, basic income projects, but they can't necessarily say like, we think you should support, measure such and such. typically our stuff has been focused like really in the homeless lane, but I feel like the basic income stuff really skirts that. And Jamie, I don't know if you have anything to say about this, like where it's one of those things that's like right on the edge of sort of our world, but totally related.
I think it could be kind of in that broad system sort of bucket, because I know that, and Caroline would be a good person to check in with. Like, I know that there's some things that Tipping Point is doing in Contra Costa around basic income. I know City of Concord is having their thing, and that's kind of upstream from what H3 does, but that doesn't mean it's not intersecting. So it could be interesting to just in the learn kind of spirit hear about it, and even if there's not a direct action step we can take, it's good context to be aware of.
Great.
And for folks who don't know, Caroline Miller is H3's public policy manager, and she works a lot on issues related to youth homelessness.
Mm-hmm. Anything else sort of in the learn bucket? I mean, I think this will keep us busy for the rest of the year, honestly, but just wanted to put it out there.
I would just wanted to, at the meeting last week, Wade mentioned that Bay Area Rescue Mission was experiencing more young people than they've ever experienced in the past. And I thought that was kind of like a little alarm bell in the back of my head. And so if we're kind of like talking priorities, between that and the direct cash transfer for prevention pilot that Tipping Point, Rise, the 4 CD district we're doing is launching. That's what I did this morning with our training, part 1. So I definitely think that a good deep focus on figuring out how all these systems are interconnected, because I do think we're going to end up doing a ton of work on youth and young homelessness. I've been doing it. And so I'm still confused. Juno's confused on how it's all interconnected. And so I think if we're talking priorities, I would love to see that, but I'm being a little selfish here.
No, that's important. And then Jamie, actually, again, I'm going to put you on the spot. Sorry. And I can't remember the details, but I feel like there was something coming out from HUD around seniors and homelessness. Like, do we think that's going to be a priority?
Yeah, so
NOFO? Do we know for sure?
We don't know anything for sure. HUD likes to keep us on our toes. But what Homebase heard, and Homebase is a consulting group that works with us to facilitate a lot of our meetings and whatnot. Y'all have probably met them many times. What they heard at the National Alliance to End Homelessness conference that was just happening in the city in San Francisco last week, HUD shared that senior homelessness is going to be a big priority for them, and that there are potentially permanent supportive housing project funding available. I think right now, actually, there's a PSH for seniors NOFO out there for HUD-funded projects, but it's only something that developers and nonprofits and whatnot are able to apply for. It's not something from the COC. So I think it will be. I don't know what form that'll take. What someone said to me one time that resonated is that HUD, like COC NOFOs, look really, really different from what they did in like 2016, but year over year, they're not making major changes to the NOFO process. So I think we might see a little bit of shift in emphasis, and hopefully in May or June, they'll drop the NOFO and we'll have plenty of time to work through it. And I say that with only a little bit of sarcasm around plenty of time. We'll be moving fast.
And just a reminder for folks, the NOFO is the Notice of Funding Opportunity, which is basically when HUD says like, hey, we have your big pot of money, but this is what we want you to focus on, or this is what we're going to like allocate it for. So just context if that's new. Okay, are we okay to move on past the learn topics? All right. So we're going to have 3 presentations during this learn section. So first is going to be Jamie Schechter talking again about reentry, and she'll tell you more about that. Mary is going to talk about coordinated entry, and then I'm just going to like line up some basics around last year's annual report so that you all can be prepared to think about it even more specifically at our next meeting. So with that, Jamie, I'll be your Vanna.
Okay, let me just finish typing out this thing in the chat. I'm sharing the link for HUD's section 202 supportive housing for the elderly program NOFO that they posted. And that is a mouthful. All right. So last time we met, there was conversation about, what is it, how does H3 interact and how does the COC interact with the reentry system? And I had shared that we presented to the Community Advisory Board back in December about recommendations around AB 109 funding. And so to kind of provide more information on what that actually is, I wanted to kind of start with the 101 and give a recap of what we presented, because it was kind of just a blip during last time's agenda. So to set some context, what is AB 109? AB 109 is an assembly bill called the Public Safety Realignment Act. And what it does is it transfers responsibility for supervising specific low-level inmates and parolees from the state, the California Department of Corrections and Rehabilitation, to the counties. So counties took on a lot more responsibility in terms of, supervising folks who were on parole or were incarcerated for low-level offenses. And with that came funding. So it wasn't just the state telling us to do something without any resources attached to it. They actually gave funding for this. The probation department will have a lot more information. I am not an expert, so I want to just preface all of that. And I put the link in there to the probation department website where you can learn a lot more. Next slide. So what is the Community Advisory Body or Board? Sorry, the Community Advisory Board, forgot the B in there, or the CAB for AB 109 Public Realignment, that's the full name, was established back in December of 2012 to do a lot of different things. Provide input on community needs, assess implementation of realignment, review data on realignment outcomes, advise the Community Corrections Partnership on community engagement strategies. So it's kind of a funky structure. The CAB reports to the CCP, that reports to the county. They're all advisory bodies. If you think we're complicated, buckle in for this one. They offer recommendations for ongoing realignment planning. They advise county agencies regarding programs in the county, and they encourage outcomes that are consistent with our strategic planning. So it's not just, putting out goals that don't necessarily align with what we have overarching strategies for. So that's what the CAB does. And as Jamie said in the chat, Nicole Green, who's also on the Council on Homelessness, is a member of the CAB and does a really great job of reporting to the council things that the CAB talks about. And she'll be coming to one of these meetings in May. Is that right, Jamie? Great. See head nods. And she reports to the CAB about things she hears at the council. So it's really great kind of liaison work there. Okay, so in December, H3 and other housing service providers attended the Policy and Budget Subcommittee meeting. And the goal was to share information on housing services and recommend some priorities for AB 109 funds. This year we have some one-time excess AB 109 funds, so they are trying to assess, what are programs that are ongoing funded, and then what are things that they might need that we can utilize these one-time extra dollars for. So I put a link in the presentation itself, and you can access it through the meeting materials, but I can also drop this link here. Oh, that's the wrong link. Sorry, guys. I can drop it afterwards. That has the full kind of report that we wrote along with our other housing providers who were at the meeting, and you can see what was discussed there. So next slide. So we shared some information on services available and what was utilized through the COC and some high-level funding information. And so the way I organized this data was through kind of our program models and the funding sources that underlie them, the number of households we served in 2022 calendar year, and then of those households, how many had kind of disclosed that they were justice involved. And so you can see that some programs have higher amounts of folks with justice involvement, and some have lower, but overall, most people we're serving don't disclose that or connect to that. And yes, you're going to learn more about these very soon. We also shared some recommendations because that was one of the goals that the CAB invited us to present on. And some of the recommendations we shared were increasing street outreach so that we could connect AB 109 clients to services, prevention and diversion to support AB 109 clients in retaining housing, bridge housing as a model to support clients with identified housing pathways and create that flow into our emergency shelter system, and rapid rehousing to create more permanent housing resources for AB 109 clients. Go
Jamie,
ahead.
do you mind explaining sort of bridge housing as a concept?
Yeah, so it's similar to interim housing, but it's meant to be kind of another step on the continuum, right? There is kind of the interim emergency shelter housing that's, you know, what we typically think of. It's Concord Shelter with their lots of staff on site, kind of a lot more supports available. There's our non-congregate setups, and then the bridge housing is meant to be kind of a step between interim housing and transitional housing, where folks who have that kind of identified housing pathway, they might be waiting on a unit to turn over, they might have a voucher in hand, they don't necessarily need, you know, all the services that might be embedded into a shelter, but they don't quite have their permanent landing space yet. That could be a bridge housing. We have a lot of folks who tend to stay in our shelters for a really long time and don't necessarily need to use all the resources that are available there, but they don't have anywhere to go. So this is our way of trying to make sure people are matched with the right level of services and creating that flow within our system, because we don't have length of stay requirements on our system and our shelters, which is a good thing, but it can tend to create a bottleneck. So is that helpful? Any questions about that? Okay, so those were the recommendations that we proposed. I think you'll get a lot more information from the CAB and from Nicole in upcoming meetings. They are working, from my understanding, they're working to develop recommendations and proposals for the excess funds for next fiscal year. Oh, yay, Rachel, that's great to hear. So I'm hopeful that, you know, we'll learn more about how they're going to be investing those soon.
Hope I see your hand up.
Yes. So the funds that are like for resources, would those resources include mental health resources, or is that a separate fund?
We presented on housing. I know that they also heard from behavioral health and other types of providers. So that's definitely something that they are considering, of like, how do we address the priorities within the AB 109 kind of goals, and behavioral health and mental health resources are part of that.
And then to clarify, AB 109 clients are clients that came from the Department of Corrections.
So
And-
generally, they are low-level people who got convicted of low-level crimes, and they could have been paroled from a state facility, but they're yeah, so they could have come from Department of Corrections, I think. Yeah. Again, not the expert, but trying to be.
Okay, okay, very good. How large is this population that we're talking about?
That's a great question, I think, for Nicole, because we track the folks who are, you know, kind of coming through HMIS and coordinated entry and all those places within the H3's data, but she could give you the kind of the full scope.
Other questions for Jamie? And yeah, just a reminder, we're gonna have Nicole come in May, and this is her jam. This is what she does. So she can help answer a lot more questions around the reentry piece. Specifically, this is like about kind of the bridge. And if you think of other things that you want to know more about, and or you definitely want Nicole to touch on based on what you've learned here, let me know and I can forward that information to her to prepare for when she presents to you guys in May. Are we good to move on to coordinated entry? Okay. Mary, you tell me when you want me to move.
Okay, thank you. Hi, everyone. So here today to give this group a little overview what coordinated entry is mainly. And some of the beginning of the presentation, we'll do a little bit of level setting, just kind of giving you also an overview of like what is the COC, what we do at H3. A lot of it you probably already know or have gotten from Jamie in another presentation or in council onboarding. But you know, I use this presentation in a few different places, so not everyone has that background. So for those first few slides, I'll probably just breeze on through. And the bulk of our discussion here today is really to give you guys that overview about coordinated entry specifically. So jumping right in, again, the goals of this presentation are mainly to learn how folks get connected to homeless services through coordinated entry and our access points, and a little bit of background about the COC, but for that, I'll probably breeze through again because you probably have it. This is setting a little context and level setting for folks. Jamie, I know we like to sometimes include this slide just to give you folks a sense of the need of what you know, we're trying to do with our homeless services and the volume of folks that we're serving. So this is PIT information from last year, where we learned that there could be roughly 2,300 people experiencing homelessness on any given night in our county. Again, this is a bit out of date, but just to give a little context and level setting about the need that we're working. Majority of those folks are living unsheltered. I point out this data point because one thing that comes up, and I know that this group maybe has asked about, is shelter, right? Folks getting into shelter. As you can see, we have 30% estimated to be in various shelters, but a large majority of folks experiencing homelessness are unfortunately living unsheltered or experiencing unsheltered homelessness. Next slide. Thank you. This is our mission or kind of statement here for H3. Again, not necessarily specific to coordinated entry, but just to do some of that level setting. So what we do here at H3, really our goal is trying our best to make homelessness short-lived, non-reoccurring, by ensuring that integrated system of housing and support services. So coordinated entry, where we come in, is on that system level side. Here's a little graphic about the various hats that our division wears. We do so many things, so it can be kind of confusing even for some of us on the inside of, wait, how is this related? Or what are we doing here? Okay, we provide services and we do this and that. So I really love this graphic because it just shows all of the things that we do within H3 as well as our stakeholders. So, you know, we're a funder. We contract with various agencies and our partners to get programs out there in the community. We have our research and evaluation team that really helps drive where our services go and what changes do we need. Policy and advocacy. A big piece, and where I will talk about, is the system infrastructure piece. So our COC team, our coordinated entry team, our COC team kind of wears a few hats, but specifically coordinated entry, this is where we land, providing a piece of that system infrastructure to all the providers that we work with. So that's kind of where we sit. Next slide. What is the continuum of care? Again, you guys have probably all gotten some form of this somewhere else, but that is our broader system of care, really designed to provide all of our housing and homeless services. And it's all of us together. It's H3, our systems teams, but also all of our service providers and partners. We all make up the COC. But I give this background information because what is our team's role in this? We are the COC agency, or COC lead agency, providing that service system infrastructure and support, putting all the pieces together. And we also operate the coordinated entry system. We're the CE lead as well. So that's kind of where we fit in. Again, some background context for the group that you probably already have, but is still helpful in understanding where does CE fit into the bigger picture. This probably also have seen, but just an overview of what that structure looks like. The leadership being our governing board, you all that help, or on our Council on Homelessness that helps drive some of our decision making and efforts, and also our different teams, the COC team, HMIS, to provide that service, the system infrastructure, and be that administrative entity supporting the whole system. So doing this background work of bringing it all together. Next slide. Do want to briefly touch on program models, just again to provide some of the background context as we jump into learning specifically about coordinated entry. I bring up the program models because each of these programs that you see here on the screen would be programs that folks, or services that folks can hope to get connected to through the coordinated entry process. Some of these entities, like our outreach team, our care centers, they are our access points where people and make referrals to other programs through coordinated entry, and some are programs that we are sending our referrals and connecting people to. I'll just go through each of them really briefly. Prevention and diversion, those are all our efforts and programs really designed to prevent folks from ever experiencing homelessness. So that can look anywhere from eviction prevention type of services, if people are just, they experience a hardship or maybe change in the household and behind on rent, and need help getting caught up, or they do need to leave, or they are in a situation that they can't stay and they need help relocating, otherwise they'll become homeless. So those are our prevention and diversion. Also conversations where folks kind of get some guidance and support on, are there other support services or networks or people, family, friends, community members that they can go to avoid, again, them ever falling into homelessness. Street outreach, that's our core team that's out there servicing folks experiencing unsheltered homelessness. So, folks that are in cars, are encampments on the streets, providing them connection to services and some basic needs as well, or helping them get connected to things like benefits. CORE is one of our access points for coordinated entry. Then our care centers, also one of our access points with coordinated entry. Our care centers, folks can get connected to, again, those basic needs, but also mainly different services that they could be needing. Our emergency shelters, those referrals, so there's all kinds of shelters in the community. Some go through coordinated entry, some don't for those referrals. We do have a portion of emergency shelters that all those referrals occur through the coordinated entry system. In our community, that includes our Brookside shelter, Concord, one moment. That includes our Brookside shelter, Concord, Delta Landing, and Mountain View Family Shelter. Then we have our Rapid Exit program. Rapid Exit programs is designed to help folks quickly exit homelessness that say they've, and they're experiencing homelessness, but they've found a housing opportunity and they just need kind of quick, light touch support and financial assistance to actually get into that housing opportunity. That's what a Rapid Exit program would cover. That's usually like deposit, first month rent, maybe moving, kind of a quick step of assistance to help folks rapidly exit homelessness. Then finally, the last two are more kind of supportive and a little bit longer term housing opportunities through coordinated entry. Rapid rehousing, which is, I love Jamie's example of rapid rehousing being like training wheels, where it's time limited financial assistance for folks experiencing homelessness to get into housing. So the program provides case management, employment services, really all the support a household might need to get into the space where they can eventually maintain housing on their own, but just are needing like time limited support to get into housing and get into the place or situation where they're able to stabilize on their own. And typically rapid rehousing would be anywhere from 6 to 18 months, depending on the household situation. And then finally, our permanent supportive housing. This is for the most vulnerable in our community, those that are experiencing chronic homelessness and have a disability, or the head of household has a disability, and that is long-term placement, basically for the lifetime of the program, as long as it's up and running, where folks get ongoing case management support, ongoing financial assistance, or their housing placement is based kind of on their income. So I go over these just to give you guys an idea of what type of referrals programs folks can hope to be connected to through coordinated entry. Next slide, please. So what is coordinated entry? Now getting into the bulk of why I'm here with you guys today. So coordinated entry is really meant to serve as the front door for connecting people experiencing a housing crisis to homeless services. So, when you're in that crisis, when you're experiencing homelessness or some sort of emergency with your housing, people aren't going to know all of the resources that are out there or who to go to, who to talk to. But as long as people make it to coordinated entry, one of our access points, the goal is really that we're able to connect folks to and give them the information they need to get services to improve their situation and find stable housing. And what does the coordinated entry system do? We are designed to prioritize the most vulnerable for the limited resources that are available. So unfortunately, I'm sure as you guys are all aware, there's a much greater need than we have resources for. So coordinated entry system helps us identify who really are the most vulnerable to prioritize for what options we do have available. One example I have is, with healthcare, when you go into an emergency room and you're having an emergency, you can't be turned away. You have a child and you're living in a community and you want to enroll them in school, the school has to make space or find somewhere for them to go. Unfortunately, with our resources in homeless services, there's not yet adequate resources to meet that need. So we need some type of system in place to help us know who we should prioritize, and coordinated entry is that system. And it's also, it's how we quickly identify, assess, and connect people experiencing a housing crisis to the most appropriate available resource. And then finally, providing that infrastructure to the system of care, or infrastructure support to the system of care by acting as a centralized entity to connect and prioritize people. So that is kind of what coordinated entry is in a few bullet points to help folks understand. Next slide. And again, a graphic to really reemphasize that is one being the system ensuring everyone experiencing a housing crisis have access to homeless services, allowing us to identify, assess, and connect people to the most appropriate available resource, and prioritizing the most vulnerable for the limited resources that we have. What those elements of coordinated entry are four. So the access piece, so our access points, how people get connected in our community, and we'll go over this. We have three main access points: our calling 211, a mobile, option, connecting with CORE, and our care center. So the access is really that engagement or entry point for people experiencing housing. Next piece is our assessment piece. So the assessment is our method or tool that we use to assess a person's housing needs, preferences, and as well as their vulnerability. Prioritization, and this is where the coordinated entry system helps our COC manage the inventory of housing resources and services that we do have through prioritization. And then the final element of coordinated entry is that referral piece, us connecting folks to the services that they may need or that we have available to help them get stably housed. What our team does behind the scenes. don't always include this slide like for all the presentations, but I thought it would be helpful for this group to also understand, you know, what our team is doing behind the scenes to just make the system work in what we do on the back end. So our team coordinates with our access points to ensure services are being provided, ensure people have access, updating our access points and teams of new resources, so working together to make sure folks are aware of the different resources available. We host some of the system level coordination and meetings to support that, such as hosting our various provider meetings within the system of care. So we host a monthly homeless services provider meeting, provider meetings for the different program types, and other collaborative meetings with some of our partners, such as Housing Authority, EHSC, etc. We oversee the system and our prioritization kind of list or inventory of people, as well as housing openings and programs and resources. We host housing placement meetings and case conference meetings to identify folks for the various housing opportunities. And of course, we review and process referrals for many of those openings. This includes looking at application forms and work within HMIS. So that's kind of some of behind the scenes of what our team has.
Mary, one thing I wanted to drop in here to provide context for this group. So like we've talked some about like the housing assessment form that gets used, the VI SPDAT, right? So that's this tool that gets used all around the community, but then Mary's team actually takes all that data and they use that to make the decisions about who gets prioritized. And so if there's an issue with the tool, then by the time it gets to Mary's team, like they have to work with flawed data, but they have to go by the system, the way the system is set up. So this is like why we're looking at redoing the VI SPDAT, because Mary's team may see like, wow, there's really big inequities in who's coming to the top of the list, but we've made a decision to use this tool. So again, just thinking about this group and how we think about the places where there's inequity in the system, that's part of why we're looking at redoing that housing assessment tool.
And one thing I wanna flag, Hope, and please, maybe I'll slow down and I'll stop if anyone has questions, because we're a small group here, so we can fully have like this as a conversation. Hope, I just wanna really like acknowledge and mention your comment in the chat. It's not that we have limited resources, it's that housing and homelessness are not a priority to our government. Thank you for that comment. It's definitely one of the challenges of the work that we do, because I'm sure like all of you, we want to help everyone. We believe housing is, a right. And, so it definitely is the fact that we're having to prioritize folks is one of the hard aspects of this work for our team in particular. So thank you for mentioning that, and definitely, agree into a sense in that. It's also will be nice if we had everything we need for everybody. But I think that your comment also highlights why it's important for places like this group that we're really able to provide some of the directions to like policy advocacy, or using our data and outcomes to support what type of solutions will work for folks, and to work together to identify those solutions. So yes, definitely feel you on that and agree. So jumping right back over, how to connect. So this is, what folks need to know, especially when you come across people in the community, how to help empower folks with the information they need to get services. Next slide. So again, we have 3 access or entry points for coordinated entry. Sure, you guys have seen this many times or seen the flyer, shared the flyer. Flyers being updated, by the way, thank you, Jamie, and this group. But really quickly, those access points for how folks get connected, there are 3 ways. Calling, so calling 211 And if you are in the situation where you, a lot of resources and whatnot can be provided through 211. And one of their particular areas of emphasis is in the realm of prevention, rapid exit, or diversion. So folks that maybe they're not yet experiencing homelessness, 211 is able to make direct referrals within HMIS to our prevention providers, and also connect them to our other access points such as Care Center or CORE. But first option folks have is calling 211. They hold the database of really all the resources that are out there, so they're very helpful in connecting folks. Next is our Care Center. So these are drop-in centers that people can go to access basic needs, get connected to coordinated entry, get case management. We have 2, and those are at Trinity Center in Walnut Creek for adult households, and we have GRIP located in Richmond for any household type, adults or families with children. And I really like to uplift these sites because they offer places that people can drop in, get a warm meal, connect while they're getting connected, get set up to receive mail, do laundry, possibly take a shower. So a lot of those basic needs. So it's a really great resource for folks experiencing, unsheltered homelessness. They have a place to come inside, take a break, get a meal, and get connected to services. And then, of course, for our outreach team, at this point, we definitely have more than 14 outreach teams. It just goes to show maybe how old this graphic is, but I think we're up to 20 something teams.
We're at, I think, 19, and what's kind of wild is that this graphic isn't that old. We've just been growing pretty quickly.
Yeah, because it's the new logo, right?
Yeah.
But our core team serves those experiencing unsheltered homelessness, and they do amazing work out in the community where they're able to connect with people where they're at, connect them to services, get them, the CORE does so much. They provide sometimes basic needs like packs of hygiene kits, tents, blankets, sometimes food, snacks. They can give people rides to appointments if they're working with CORE. There's a lot of things that they do. They also are able to make connections to shelters. But they really do a lot, and they are main access point for a lot of folks out there experiencing unsheltered homes. So that is how to get folks connected. Next slide. So here is kind of a web of a big picture of what folks might expect once they are connected. Based on their situation, they can expect to be connected to different type of services to hopefully help them get stably housed or get some of those basic needs met. So that could look like being connected to prevention and diversion resources, temporary shelter, supportive services, and supportive housing, or a combination of the many. A lot of times, especially when it comes to supportive housing, where we simply don't have enough and we're having to prioritize folks, someone can be connected to maybe shelter or supportive services like food and clothing, mobile hygiene, safe parking, while they work on a larger plan with their case manager or folks supporting them towards housing stability. So it could look like one pathway, but for many folks, it's a lot of pieces to the puzzle that we're connecting them to get their needs met, both in the right away as well as long term for housing stabilization and locating permanent housing.
I wanted to flag the Hope's question in the comments. I don't know. So Hope is asking like how much CORE has grown in the last few years. For example, how many teams a year ago versus 5 years ago. Jamie or Mary, I don't know if you want to speak to that. I mean, rapidly, but.
I'm trying to look up see if I can find anything that's more than a lot. But I know we started with very few CORE teams, some of whom were 3. We started with 3. And
like probably a little over 5 years ago.
Yeah.
We had 3 teams.
We had 3. And so at this point we're at 19, and I know we're looking to add more teams in the coming months, next fiscal year. And I've asked Jenny Robbins, our chief of programs, to see if she's interested in coming in either May or June when things are a little bit more firmed up. The thing that is really helpful for CORE in terms of growing is that they're all pretty much self-funded teams. And what that means is that cities are contracting directly with H3 to fund a core team dedicated to their city, or they split one with another city if they don't need a full-time one. We have some specialized teams like BART and Public Works, where we receive funding from those county departments or regional departments. We apply for core teams through grants like Richmond's Encampment Resolution Grant. So the more kind of funding resources that are out there for us to kind of hustle after, that we try to embed CORE as one of our key access points in a lot of different ways. And so that's really been a key component of why we've been able to grow.
Have phone calls been coming, like being returned a lot faster? Because I feel like even from a year ago when I first kind of started with coordinated entry, like I do feel like there's been a lot of improvement. And so I was just kind of curious on like if there were kind of like big changes in like the last specific year or so.
There was a big change. I can't give you exact kind of info on phone calls and how they work with them, but Jenny definitely can. But they did make a big change in terms of the dispatch system that they implemented. So they were using one thing and it was being routed through 211, and they replaced it with one with a system that's much more clear. Like 211 has more of a clear phone menu now that folks can access better, and the dispatch system has like a more comprehensive phone tree from my understanding. So I know that they've gotten better resources and technology in place.
I have a couple of questions.
Go ahead.
One is the CORE team.
Mhm.
How big are the teams? Like how many members are in a team? Is there like a specific amount that they need before they become a team, or is it just a couple of people?
Yeah, each team is about 2 to 3 people. So folks always are going and doing outreach in pairs at the very least. And some teams are what we're calling a CORE Plus team, where they have like kind of mental health clinician on the team as well.
Nice.
So I think some of our like our CalWorks team, which works exclusively with families, is a CORE Plus model that has a social worker on staff.
And then my second question is, are they employees of 211?
No,
No.
they are employees of H3 through our contractor Haluna Health.
Oh,
So they're
got it.
managed by H3.
Boy, oh, they.
Mhm.
Boy, okay. All right.
And I will say about, I think over 70% was that last I checked, the data of our core staff have lived experience of homelessness. So they're folks who are real near and dear to the issue and have a lot of that expertise that they're bringing to the work.
I'm just flagging, this is one of those times where people sometimes are like, wait, H3 does direct services, but we also like me and Mary and Jamie are like the
Yeah.
administrative piece, but then we have this whole service line. So like we run some
That's why I
shelters,
love
we
that
run
flower
CORE.
picture.
It gets really confusing for folks, so.
So, when going back to one of those original graphics they shared with all those little petals of the flower, pieces to the puzzle of one of the hats we wear, H3 is operating programs, being a provider. And CORE is one of the programs that we operate. So we operate some PSH, we operate CalAIM of late, we operate our some of our shelters, right? Provide the staffing to the shelters as well as CORE. I think a lot of people, maybe the confusion with CORE and 211 is that to reach the CORE dispatch line, you call 211. It's not a separate number. And that's just meant to make it more accessible for folks. You call 211, press option 3, but they are not like a staff of 211. Good question.
And I just have the slide up right now. Everything of the blue circle is direct services that H3 is one of the providers for.
So on the permanent supportive housing, does H3 partner with affordable housing developers to provide services to permanent supportive housing communities directly, like an Abode or Shelter Inc.?
So H3 has 3 COC PSH contracts for folks who are getting real deep into the review and rank process. It's Destination Home, HUMS, and Permanent Connections are our 3 projects. We provide directly the supportive services to those clients, and Shelter Inc. is our subcontractor, I believe on all of them, that does kind of the leasing assistance, rental assistance work. Those are scattered site models. where they are reaching out to landlords, many of whom are affordable housing providers, to find units and then have that tenant live in that unit with services provided by H3.
Got it. But it's technically through a service sublease to Shelter Inc.
Right.
And then it's not like new tax credit development projects as much, or
If you know, it can be a variety of different setups of if a new development comes up and we have an opening and that person is eligible to live there and they can accept kind of tenant-based rental assistance, and that's a referral we can make. But it's a scattered site, so it can look a lot of different ways, and Shelter Inc. is the master leaseholder.
I see.
And-
Yeah, in our world, we're like directly contracting with Shelter Inc. or one of any of the good service providers, because HCD and TCAC funding to build the building requires a service provider to be attached to the building.
Yep.
And they have to have past experience with HCD and TCAC funding for special needs. So I was curious if that's similar to what H3 is doing or slightly different. Sounds like it's a little bit different.
Yeah.
Great question. And Iman, one thing I'll flag for you is one of the things that wasn't circled there, rapid rehousing, we contract with other entities like Sheltering Solutions, et cetera, to provide rapid rehousing. But one thing that would be great is increasing our relationship for our rapid rehousing providers to affordable housing, because a lot of times, the best solution for people is locating a unit that is affordable to them, and that is very hard in our community. So, one thing that would be great to kind of work with you on or continue to get input on is building those connections with affordable housing providers that maybe not those relationships that look like a contract where someone is providing services at some of your sites, but how can we get, make sure our providers and participants are aware of the affordable housing resources that are available. Or if we do have vouchers or other things that we can partner with, like having the connections to affordable housing providers, we have them, but always definitely room to strengthen those relationships. I think on our end, we try our best to blast out the wait list information for the various affordable housing entities and stuff, but definitely always interested in increasing that relationship, because a lot of times it is a little hard to get folks connected to affordable housing, and I'm sure that's also because of just how much is out there. But that's something I'll mention, to plant the seed.
Yeah, absolutely. I'd love to help with that. I think, part of the challenge is a lot of the projects have site wait lists that are giant, and there's not as much turnover as one would think in permanent supportive housing communities. And some of the other types of affordable housing, that's restricted to 80% AMI, often is too high of a rent for folks. So even though there's a lot more of that more moderate income deed restricted housing out there, everybody's looking for the 30%, 40%, 50% AMI housing, which is in hot demand and unfortunately oversubscribed.
Great question. Moving right along, I want to plug this flyer is being updated, but this is, one of our flyers that, feel free to share. We can link it in the chat, but it shows on the front side how to get connected to services, but as well on the back, love to share the different shelter options within the community. A lot of folks maybe think, oh, I can only get shelter if I call court. But in reality, most of the shelter options are self-referred through these other kind of means. So this information I feel is really empowering to folks experiencing unsheltered homelessness, because it puts at their fingertips, how can I get into shelter? We know there definitely isn't enough shelter beds for how many folks need it, but there are various avenues to get shelter. So it's always helpful to get that information into the hands of those that need it, so they can hopefully get access to shelter. Next slide. So type of housing that types of housing and resources that, again, folks can get connected through coordinated entry. Those will be the last two that you see. And again, that is our rapid rehousing programs and permanent supportive housing. So these are the types of supportive housing opportunities that coordinated entry will connect folks to. And again, that rapid housing is time limited assistance, and permanent supportive housing, not time limited, really providing controller level of services to folks who are considered more vulnerable, those experiencing chronic homelessness and have specific. Slide, please. Here we have, this is, I include this information to again give folks some context about the level of need and kind of what we're working with on our end in terms of connecting folks to resources. So who is seeking supportive housing? As of recently, within the last 8 months or year or so, and it's not too much change since then, but we have roughly 2,500 people kind of in our coordinated entry system that are scoring in the range of needing some type of supportive housing, be it rapid rehousing, which is a certain percentage, but many of those scoring in the range indicating that they really need that level, a more PSH level type of housing solution. So kind of giving you a sense of the need of, there's definitely many people that need this type of housing, or that their kind of assessments indicate that this would be the best option for them, but not able, don't have that level of resources at the moment. A third of those folks connected to our coordinated entry system are chronically homeless. So they've been experiencing homelessness for a long period of time, or over 12 months, essentially. And a data point which was definitely, it has increased from 2023, but from 2022, we made roughly 537 referrals to permanent housing through coordinated entry. And this includes PSH, rapid rehousing, and voucher opportunities that we've been able to connect folks to. It's a very small percentage of PSH, but I know for 2023, and I'll try to share that information at a later time because we were able to share that in some of our other council meetings. But we did see an increase to referrals to PSH and rapid rehousing in 2023, and we do anticipate that as well for 2024. And that's just reflective of the work that our community has done to really prioritize increasing the inventory of PSH and rapid rehousing. Go ahead, Jamie.
I just want to make a kind of a comment on chronically homeless, because we see a third of folks showing up, on that date in August as chronically homeless, but chronic homelessness requires a lot of documentation. It requires having a documented disability status. It requires having documented length of time homeless. And so just want to put that perspective out there that it's really challenging to get documentation in order when folks are experiencing homelessness. And I think that is an underestimation, but those are the folks that we have pretty good info on.
Leslie, I see your hand. Oh, go ahead.
Oh, no, go ahead, Leslie. I'll wait.
Oh, okay. So yeah, I was actually going to echo very much what Jamie just said in terms of the specificity of who's eligible for PSH. And so it's kind of hard to compare apples and oranges, the numbers of people who are in line for PSH versus have we done any sort of pre-check to see if they technically would qualify. But more importantly, my other observation about this slide is it might be helpful to separate out how many are in line for RRH versus PSH, because that's a different set of people potentially. Not everybody who wants RRH or PSH is eligible for PSH, but it could go the other way, except been our practice recently to, determine what would happen if someone got RRH, because that's the next resource available, but really truly probably qualifies for and needs PSH as a long-term solution. So I think it's a little more nuanced than just lumping those groups of people together. That's all.
Mary, you're muted.
There we go. Thank you, Leslie. Great point. And things to point out. One thing I'll say for you know, yeah, how it's a 77% score in this range, are they actually eligible? Some of the questions in the current assessment do kind of indicate some of those eligibilities. So if they're scoring in that range, a lot of times we can not assume, but it is an indicator that they would meet that eligibility. So it's documentation wise not always there, but they're scoring within that range. It's an indicator that they most likely would, unfortunately. So we do some of that, and the housing needs assessment will kind of reveal some of that early on. And then in terms of lumping folks together, I definitely hear you there. But one thing I'll say is with our current coordinated entry system, it is kind of one pool, but we use case conferencing, our housing needs assessment kind of score, and a lot of different tools to really determine before making a referral if it's appropriate for the person or what they're needing and preferring as well. So this point could possibly change when we do our CE project, as we believe that will affect prioritization. But currently in our community, it's all one kind of, it's all pooled together. There are other communities that their coordinated entry system is set up that they have multiple pools where they do have a separate list, if you will, for folks needing or appropriate for rapid housing and those for PSH. Our community, we have one at the moment. However, we do use our assessment score, case conferencing, and other means, HMIS, to kind of help guide what would be more appropriate. And most importantly, also incorporating the purchases preference. Go ahead, Jean.
I can't remember if we've looked at this recently, but have we looked at this list? Like if we pulled everyone on the community queue, have we looked at like the race ethnicity to see like what, if there are inequities? I mean, we know that there are issues with the VI SPDAT, which may lead to this being skewed in a certain way.
So that'll align with our kind of system data with what we see in HMIS. So we do know that certain populations are overrepresented in HMIS, and that's reflective in the queue. So that will look like people of color, specifically African Americans being overrepresented, increase in seniors, most people experiencing homelessness is single adult households. So some of it, for the most part, aligns with our overall system data of who is accessing homeless services is reflected in our community or in our coordinated entry system. Good question. I'm looking at the time, and I'm sure you guys have other things to talk about. Next slide. I think we're coming up on the end. Again, recapping what is coordinated entry. It's a system we use to identify folks experiencing a housing crisis, assess and prioritize them, and make referrals and placement into housing. Next slide, please. Recapping how to access coordinated entry, call care for. Next slide. And that is all for today. If you have questions or any follow-up to the presentation, feel free to email me, or you can email Contra Costa COC and you will get Jamie Jeanette.
Could get any of three of us.
She will field your questions or direct you to the right person on our team to help you out. Before we wrap up, I know you guys have other things. Just want to see if there's any last questions.
Yeah, could I ask the question I wanted to ask a few slides ago?
Sure.
Jamie mentioned the chronically homeless not having document ready stuff. Is that based off of HUD's definition of chronically homeless?
Yes.
Is that their requirements, their...
Yes. And so what Mary talked about is like, if they're scoring in that range, they might not be fully doc ready, but if they're scoring and their length of time is high, they're coming to the top of the queue, and their case management team and the coordinated entry team support getting them doc ready. So people might not come to our front doors, designated chronically homeless doc ready, but if they're getting those high scores and they're having that long history of homelessness, then we're working with all the resources we have to, get things like birth certificate, like a third-party verification of their
Right,
disability.
okay, so the way I was understanding it was that they didn't have to be doc writ, okay, no, we're good. I understood what you said differently than what you meant, so we're good, thanks.
No problem.
Great question. Any other? Hope, I saw you had, go ahead, Hope.
Yeah, so my question was regarding kind of like most updated data. I know that it kind of seems like a lot of the reports, they do tend to be like take a little bit of time to come out. One of my questions is during kind of the onset of COVID, a lot of counties had like database systems that would either update weekly or, something like that. And I just wondered if like that has ever been talked about in the past, or if that's ever been a thought process just for like transparency, or to be able to like see trends in the moment.
So Jamie S, I see. Okay, go ahead.
Yeah,
Jamie.
I'm kicking that around a little bit because I'm trying to think about what problem would that solve. Our list doesn't fluctuate hugely on a day-by-day kind of basis. Folks who are in the system, we don't have like this giant influx of very new to the system people coming in on a day-to-day. And I know part of the thing that we are really careful about is making sure our data is clean. So things that we submit to HUD, we're not throwing out a ton of different numbers that might contradict each other or might change, because it's really hard to communicate the nuance of what is happening on a day-to-day basis. So that was a really cool thing that happened during COVID, and with things like vaccines given, that sort of stuff, I think is a little bit more of a narrow focus on what they were providing on a day-to-day basis. And God knows medical systems have super interesting data systems that they navigate, and it's just much different than HMIS. So I don't think it's been considered very kind of thoroughly, but we do look at ways to try to get better data shared more frequently, because you're right, it takes a long time for us to put things together, like our annual report and our PIT data and all that. So I would recommend joining the next PATH committee meeting, because we're going to talk about how to refine our unsheltered data mart to be a little bit more timely.
And one of the things I'll add, Hope, is like some of the delays of getting the data in is like, in a perfect world, like I'm a service provider, you come in, I put all this information in while we're talking, and that's like happened and the data's in right away. The reality is sometimes data is getting handwritten, submitted later. There's been a lot of work to like
And that
improve our
happened
data
with
quality.
COVID as well. And you would actually see the reflections and the changes from week to week in the data systems. I never would expect perfect data from that type of information.
Right.
I think it's helpful for transparency's sake. And also for us to like know what's up versus, or being able to like give this to my leadership or administration instead of like, I still don't have anything to give to them.
And well, we can talk more too. I'm like curious to hear what you're looking for. I mean, our annual report typically comes out sort of mid-year, and it's reflecting the year past. And PIT data also takes a while. But sometimes, and I don't know what the capacity is right now, but sometimes our research, evaluation, and data team can pull data runs for like certain slices of things. And so I can get you guys more information about that. I know they're pretty low staffed right now, so their capacity is not what it used to be. But if there's like a specific question you have, sometimes we can do a special data run.
I'm curious about things like how many calls does 211 get, and what does the return time look like, and like all these random questions.
So the other thing I'll flag is for a lot of the data, as Jamie mentioned, it's not going to widely fluctuate. So you could still, for example, how I'm able to share this slide, share it, and it's basically the same as it is today. So want to make that point. Also about staff capacity, coincidentally, I am short staffed and just kind of got plugged into this. So I could, for some of these data that I shared, easily kind of get that, but just having the time to go in and pull those reports, look at the numbers, plug it in and whatnot. So there's always that. But also you're able to submit like data requests with the red team. One thing that is a challenge is the different types of where we're getting the data, or if we have, like, we're having to pull from different reports or different places in HMIS. But a lot of what you're asking, I mean, it is out there. It's just picking from different places. Like you mentioned, how many calls 211 get? 211 is not only an access point, but they do keep information on all their calls. So that information is out there. It could, if it's specifically calls related to homelessness, we do have that data, or if it's overall, 211 would have that. So it might be, depending on what the need is, it might be piecemealing it from our different places as well. But if there is data that you're needing, Hope, definitely you can reach out to submit a data request, or work with Jamie to get one submitted of like what would help you.
Yeah, and I will say, I like absolutely want some stuff for the school, but just as a general community member who knows that homelessness is a concern, like this is something I'd want to keep a close eye on. And so that's where I kind of bring up the, like, trying to get more regular updated data. But again, I do completely understand and recognize capacity issues, trust me.
Yeah.
Other questions?
Mary, you were awesome. Thank you. And actually, this is a perfect
Thank you
segue.
for so much time.
No, it was super helpful. It was good. So this is actually a perfect segue. And Mary, if you have to go, I totally understand. You
I'm
have a
gonna jump off.
bajillion things.
All righty.
Um,
Nice speaking with you all.
Good to see you.
Bye.
So I'm not going to spend a super lot of time on this, but what I did want to flag for this group is, you know, how are we going to know that we are improving equity? One of the ways is to look at data, right? So I wanted to flag for, we have our annual report, which is probably like our most comprehensive look at what's happening in the homeless system of care. And in the packet that I posted, I included the entire like 60+ page annual report. But what I wanted to flag was like the different ways that we can look, that we have been looking at data in the past. And we are, our new research evaluation and data manager, Ayoka, is just starting the process of thinking about the 2023 annual report. And so what I wanted to bring to this group was sort of the ways that equity-related information has been tracked or presented, and see also if there, we won't really necessarily dive deep into that today, but maybe in May, like what are ways that we as the equity team might want to have some data in that report, or are there, you know, like one pagers that we would want to have? So just I wanted to do a super quick orientation to like, so we have big categories of the ways that we can look at things are like demographic categories, and I'll drill down on this, program utilization. So like what services did people use? And then like, how did they end up? What ended up happening with them? So in the so the demographic categories, actually, there's a bunch of them. So we track household configuration, right? So are they families? Do they have children with them? Age groups, race, ethnicity, gender, disabling conditions, chronic homelessness, which we just talked a little bit about. Are they survivors of domestic violence, sexual orientation, and veteran status? For program utilization, so Mary presented a little bit about the program models. So we can see, like, did people use prevention and diversion services? Did they use what we call crisis response services? That's kind of how they're bucketed in the annual report. So that includes all these things. And then permanent housing is really permanent supportive housing. So we can see, you know, how many people overall use these. Of people that use these, what were their demographics? So there's a bunch of different ways that we could slice this information. And then the other piece that we look at is exit destination. So we could look at, depending on where they came, you know, what entry point they used, what services they used, then where did they end up? So did they end up in permanent housing? Did they end up in what's called a temporary setting? Did they end up in emergency shelter? Did they end up in an institutional setting, or did they leave basically to an unsheltered setting? The other things I wanted to flag is like, I actually went through the annual report in 2022 and literally did like a keyword search for equity just to see what came up. So there's like a tiny little bit in the executive summary, which is sort of like the first 2 pages. Like under the capacity building section, we really just talk about the establishment of the equity committee, but there's not like a broader analysis of equity in the annual report. I wanted to show you, so we didn't do this last year, but in years past, we've had sort of like a 1-page or a snapshot of different data points. So one is from the 2016-2017 annual report, and one is from 2019. So you can see there's like some demographic data in there. But just wanted to give you examples of what's been done in the past. And we can go back to these, but I just wanted to, like, given all that, just to have you start thinking about the kind of work this group wants to do and what kind of tools, you know, using data. So Hope, I heard you talk about, like, we've talked about dashboards a lot in our path work, you know, being able to see sort of in a more timely fashion or easily accessible, like being able to maybe do some of this analysis. Joe.
I'm remembering Kiva right now, around the making sure that equity just isn't siloed, that we're touching every single committee, every single working group, every single discussion that we may have with this material, we have it in this lens of equity. I think that would be really important to, like, it's not just a committee that talks about equity, it's a committee that is like influencing the rest of the committees with equity. So
are you thinking like in the annual report? And one thing I'll back up and say is, like, the annual report gets used in a bunch of different ways by a bunch of different people. But it's typically, I almost think of it sort of like the kitchen sink. It's like everything we know about what's happened in the homeless system of care over the last year. So there's like tons of data, but there's also often sort of like highlights of big things that have happened. So to your point, Joe, I hear you, of like not just having, you know, just mentioning the equity committee. That's probably not going to cut it this year. So that's another piece we can start to think about in recommendations.
are we able to use that assessment that was given in, what was it, to 2022, to use that in like what we've done since then?
Yeah, I mean, I think we could definitely look at the progress we've made. Like, what were the recommendations that we prioritized? What was the progress we've made? So for sure.
Mhm.
Yep.
And just something I was gonna add is that and this is something I got from like Rise, the youth center, is talking about the idea of like, we have all this data and we want to make sure like we're not just like putting in a chart and making it look pretty.
Exactly.
Yeah, and so that's like the big thing is like, if we have a problem, I wanted to be able to show it versus, you know, let's show what we're doing good. Yeah, let's show it all.
Yep. Yep.
Yeah, that's one of my favorite things about the annual report, and I keep my printed copy with me basically all the time. I'm nerdy about it. Is that last year I think we did a better job of including success stories that highlighted partnerships, and pulling out some of our like really big data successes. Like there's a little call out about how well our data quality increased from 79% to 94%, and there's a lot of that interspersed. And I think, Joe, I like your idea of like referencing back to the report. Are there any nuggets we can pull out and say, here's something that was a recommendation, here's the progress we've made on it?
And then also too, with our new seats that we have in, like, is there any kind of like hoorah that we can say that we've like passed a milestone in our equity as far as like seats that we've been, the new seats?
Maybe.
Yeah.
Yeah, I haven't dug into that yet.
Yeah, and the other thing to just remember is like the time frame is going to be only things in 2023.
Mhm.
Like, it's really looking at a snapshot of 2023. So we might actually
Oh, the
accomplish
new
some
seats were in
things.
2024.
Right. So
Right.
just to, you know, and it's always annoying because I'm like, no, but great things have happened, but then that'll go into next year's report. But so it just hold that in your mind as you're thinking. But yeah. I'm also curious about like you know, personally in my work, I find these sort of one-page things really helpful. So one of the things this group could think about are like, what are the pieces that we would want to highlight or look at, or might be talking points that we would want to use in our work throughout the year. Like, you know, you see for 2019, like we look at the overrepresentation of African-American folks overall that are accessing services. We look at the underrepresentation of Hispanic Latinos accessing services compared to the county overall. There could be a bunch of different ways that we, you know, want to slice the data or the things that we want to pull out. Some of that we may not know until we actually see what the data looks like. But just flagging, like this is a place or an opportunity to build some tools that we might want to use for the work and the messaging we want to do across the system.
Something to maybe look into, and I might have gotten that acronym wrong, bless me. But the college, I guess we recently became, at least 25% of our population is Asian or Asian Pacific. So those numbers have risen dramatically for us. And so I imagine that our numbers match the county's numbers in a lot of ways. So I'd be curious, you know, kind of with some of our more specific populations, what shifts we're seeing, that sort of thing.
Yeah, and that's one of the things that happens is that like what's happening in our system of care gets compared to the county data overall. Yeah, Leslie, I see your hand up.
Hi, I'm back on just this meeting now, everybody. Hi.
Welcome back.
One of the issues I've always had with these infographics, and it's germane to our conversation right now, is that each year we tend to highlight different bits and pieces of information. So it's hard to tell the story year over year over year over year to see any trends. And specifically, I appreciate, Jamie, that you pointed out the two in data points on the 2019 one that are of most concern to me with respect to equity. The overrepresentation of Black and African American people in our system of care and the underrepresentation of Hispanic Latino. They each point to different problems, I think, but they're both problems. Can we do some work? Can somebody do some work on the red team to see if those data points have changed over the years? Can we go back as far as we can and create those two different specifics and then see how they've been over the last few years and consider those maybe pivot points or touch points that we measure every year? Because I think those would indicate some level of progress, maybe if they change. So that's my 2 cents worth on it. You know, we need to see some consistency year over year in what we're summarizing on our infographics, and can we at least do some historical and future work in capturing those two indicators, the number of Black and African American people within the system compared to our population, similarly Hispanic Latino.
Yeah, I think yes, I will say, looking at the report, looking at the infographic, Black African American was 42% in 2022 and 44% in 2016. So not dramatic change there. Latino was 17% versus 20%. So not giant jumps, but around there.
Trying, since like that doesn't, what we want to reflect is what our efforts are changing over the next few years. So.
Yeah, but what I will say is so with the HUD data standard changes that were implemented in October, it's going to make reporting on race and ethnicity a little bit challenging for Latinos, particularly in Latinx and all of the various terms used, because now that is no longer a separate question that HUD asks about. It is included in all the race categories, and that is a good change because it really put people who identify as Latino, Hispanic, etc., in a funky place where they also had to identify as a different race that might not have matched what they self-identified as. So for that category particularly, it's going to be challenging to show that's a pivot point right there, Leslie. It's going to be challenging to show what historical trend is. Other race categories that were consistent, like African American, will probably be easier. But I think the white category is actually going to shift a little bit too, because with that data shift, back in October hadn't introduced Middle Eastern as another option. And so folks who might have previously chosen white because they were Latino, Hispanic, or Middle Eastern, or just didn't identify with any of the other racial choices, have new choices to identify with, and it'll create some flux that I think will be really interesting to examine.
And I think that will, I'm gonna just make an assumption right now that that will be a piece that we talk about in the report.
Mhm.
That this shift has happened and what that might mean. But I'm hearing your point, Leslie, and I will say in past annual reports, not necessarily in these little like one-pager things, but we have done almost every time there's sort of like a 5-year analysis or a 5-year trend for a number of different things. So again, like Ayoka's still really getting up to speed on all of this stuff, but I think when we look at past reports, we can see that there are certain things that we've looked at consistently in terms of trends. And so this group, like this is an opportunity if you want to do homework or think about this between now and May. I'm hoping in May we can come back with some more specific questions or requests or recommendations for the red team about things to include as the annual report gets developed.
Is this where we will talk about the difference between quantitative and qualitative data and how like equity, like, is this where that conversation, because I've been waiting to figure out that quantitative, qualitative data, and I don't know if it's an equity thing.
I mean, I'll say the annual
data
report is pretty clear. It's pretty much a like quantitative data report for the most part. Like it's looking at numbers of people and things. But what Jamie said earlier is really true, is like we do have an opportunity also to use qualitative data in terms of our success stories and what we decide to highlight. That also helps tell the story with data, of people's stories in partnership with that quantitative data. Does that?
Well, that brings up the story map. Is the story map part of the annual report? Because isn't that kind of where the data lives for, maybe not.
No, they're two different reports. Last year they were kind of published around the same time. And we definitely try to keep messaging aligned. So, something that's in the story map isn't going to necessarily contradict the annual report.
Right.
But the story map was really meant to highlight Pitt and the like kind of the 1 point in time count and like the 1 day slice that we get out of that. Whereas the annual report is really meant to infuse the qualitative stories that we gather into what happened throughout the entire calendar year. So I think there's definitely room for conversation on quantitative versus qualitative. And I'm curious kind of how that would look differently in the annual report this year to you beyond, the success stories that we share and some of the kind of system initiatives we talk about, in addition to the quantitative data that is in there.
Well, right. And I think the conversation needs to be elsewhere because I don't have an answer to that. It was just a kind of is there. I think it's something we can discuss for sure.
Cool.
Okay. Are there other things people want to say or think about in terms of the annual report? We're going to bring this back in May with some more. I'm going to invite Ayoka and see if she can be part of that conversation.
Do you remember that graphic we used with, it was the 3 people on the boxes, but the equity was like all of them being able to look over, and like we were like really blown away by that new graphic. Is that something that we can use with our data?
Probably. I mean, like in the report.
Right, as a visual, because
Probably.
it really hit us when we saw it. So I just wasn't sure if that'd be something for a visual.
Yeah, we can talk to Ayoka when they get down to the graphics, which I think will be a little bit. Yeah. Okay, I know we have like 15 minutes left. There's just a few things I wanted to flag for this group. Jamie, if you need to go, it's totally okay. I know you have a bunch going on. Oh, thank you, Jamie. So a part of the work from last year was working to create some materials that are a little more easily accessible. And I've been drafting some answers to frequently asked questions. And what I wanted to bring to this group was what we're looking at right now is sort of the first pass of questions that we would want to publish. So there's a bunch more that we could probably do, but in terms of like getting something out sooner rather than later. And I have them kind of bundled under like crisis. I'll just show you really quick. Crisis, at risk, and housing. And maybe that's mostly for our purposes. But just wanted to check in with folks and see if you have thoughts around these questions. Are there other questions that you think somebody that's like, I'm newly homeless, I'm in crisis, we're gonna have the revised flyer that will tell them how to connect to services. We're working on a short video, like 45 seconds, that basically says, if you're in crisis, this is the first thing to do. But we're building these FAQs to help answer a lot of the other questions that might come up. And I'll just flag that I am working with a bunch of different folks to draft some answers, and I'm actually running them through AI to get them down to like a 5th or 6th grade reading level. So I'll bring the drafts back to you guys, but I'll just check and see. Am I homeless enough? Ooh, that's an interesting one. Say more, Hope. What does that mean to you?
A lot of times I know people aren't like, they don't think they should call because there's nothing that they're going to be eligible for. They're not in a desperate enough situation, or they likely won't qualify through our priority tools, or they think that. Like, and I can say that, like, logically, I don't think that there's any resources that I'm going to qualify for based off, my current income or my current levels. And so it's not an easy frequently asked question, but it is one I get. And I think everybody does.
Sorry, I'm muted. Something like, what kind of help can I get? Or do you feel like people are literally asking, like, am I homeless enough to get help? Or
do I qualify? Like, how do I what is qualifying to get help? Because there is a difference between getting connected to CORE and getting supplemental resources that you then have to follow up on.
Okay. So maybe something a little bit more about like the definitions of homelessness, but for lay people. Okay. We can think about that. Yeah. Leslie, I see your hand up.
May I suggest that we say, instead of how do I get into a homeless shelter, how do I get into an overnight shelter? Because sometimes people see shelter associated with Trinity Center, and that's not what we do mostly. And so if we could clarify that, what do people do about getting into an overnight shelter, I think would be
interesting. Okay.
More applicable, and also not continue to re-emphasize and emphasize homeless. So.
Great.
I can't think of a specific question, but there's nothing in there about a meal, no food. Like what's your frequent asked question around food?
Okay, so something around food. Yep.
Or pets even, but I don't know.
Yeah, I thought about pets too. Yep. And let me just see what we have. Okay, yeah, so definitely something about pets. Like I have pets, can I still, get into shelter or housing? Okay. Okay, so this is again for like crisis where somebody's literally homeless. Okay, we have safe parking, documentation, shower and washing clothes. Any other like real basic things that you think we're missing here?
So let me just, I guess, double check, because I might not know the answer. If they have a kid, if they have a baby, and clearly the baby is going to need help, what's the best place? Like,
so it depends on the shelter. Like there are family shelters, but maybe there's something like so say more, like how does that stuff come up for you, Hope? And that might help me think about how we want to ask the question.
like I'll highlight the family shelters on the flyer, but sometimes they're farther away, sometimes, and then hours are limited. So like for, especially when it comes to like a little child and making sure like I'm in that emergency situation, I think whatever they do, like in that desperate moment that like they want it to be like the step, um, that one's harder. But like, is there a go-to when it comes to like with young people, Rise is our go-to. We have other resources, but that is our, go-to. Is there anything for like, is there a specific organization that really focuses in on this population at all?
So I'll say something, maybe it's something like, I'm homeless and I have children. Where can I go or what can I do?
Yeah, exactly.
Okay, great. Um,
But also, I really don't know the answer to that one, so I'm curious.
I mean,
would
we
ar-
would, oh, go ahead, Jamie.
Calling core and noting that it's a household with children, especially if they are connected to CalWorks, is helpful.
Mhm.
And GRIP is our family shelter and also a care center, and can usually be a good referral for
Yep.
West County. East County is challenging, but folks like Winter Nights might be able to support households
Mhm.
with children as well. Safe parking is available out there.
Thank you.
So for at risk, the two main ones we have is basically like I'm about to get evicted or lose my housing, and I can't pay for housing or utilities. I owe back rent or need help with utilities or deposit. So that's trying to capture like the at-risk folks. Any other, maybe like I'm sleeping on my friend's couch. This kind of speaks to your point, Hope, about like homelessness and the definitions. So I don't know. So part of what we're trying to figure out too is like how far down the rabbit hole do we want to go with the FAQs? Like how much detail do we want to get into versus like call and talk to somebody and they can walk you through all of your options.
I don't have an answer for that, but I have feedback. Is just that like,
Yeah.
I know that every single person is a little bit different, and so there are folks who really want to talk to somebody and ask them, or there's somebody like me who, if I don't see it on the website, it's not real. That resource does not exist.
Mhm.
And like, I
Mhm.
think that was, as a neurodivergent person, that was a huge
Mhm.
concept for me, that I love all the details
Mhm.
and recognizing that's not for everybody.
Right.
So
Okay. But maybe something, it sounds like we probably need to reference something around couch surfing or couch sleeping. Okay, thank you, Jamie. And then I'll give you the next category and maybe you have some for the other one, sort of around housing. So like I've been in jail and or prison. Can I still get housing? I'm homeless and I pay rent, but I just can't find an affordable place. Can I still get help? How do I get housing if I'm homeless? How do I get a housing voucher? Let me just see if there's any others. And then there's some big system ones. Are there any that you think were, oh, well, let me just show you the next set. So these are other, like answering some basic questions, like they're going to hear about coordinated entry, like what is that? And then some definitions of these different kinds of things that they might hear about, just so that that's like, there's a definition of it in one place. Do you feel like that would be useful for people, or is that too much detail?
Go back a slide. I'm glad to see interim housing in there. Now, a lot of these questions, this was something I was going to bring up earlier, but a lot of these questions are getting somebody in the mindset of like rental. I'm wondering, because a lot of folks that I've talked to who are homeless don't necessarily want like an apartment complex, like they
Mhm.
don't. So I'm wondering, is there a way to explain getting actual house, not rental? Like, is there a, like, I guess maybe what I'm questioning, what I'm saying is that 211 core is a rental kind of, like, it will help you find a place to rent.
Uh-huh.
It's not going to help you find a home that's got like, like I just kind of separating that, but I don't,
Do you mean like people that might want to buy a place? Or are you
correct.
talking?
Yeah.
Yeah, I mean, I feel like that is, I don't know, Jamie, do you have thoughts about that?
Yeah, I think rentals are going to be the most common solution and commonly available resource out there. But I think that, folks who do things like want to live in RV in a mobile home sort of scenario, those are options that kind of get explored during case management. And sometimes that means, okay, that's the longer term goal, and the midterm goal is, getting you something that's affordable, maybe a shared housing situation that lets you stack your chips a little bit and be able to afford a more, single unit type of residence rather than multifamily housing. But we don't have a ton of availability of those resources. So our, housing case managers are always going to be giving folks what options are available and trying to balance that with what the person wants, because that is going to be the leading, thing in the plan.
Well, and I think that's the point of what I was just questioning there. I think really it is to put out there that the process is to rent. Like you're gonna go to find a rental.
Yeah.
But if you're looking,
yes, and there's also the component of reuniting with family and friends.
Yep.
So it's not always just
rental.
Right. Yeah, whatever makes the best sense for the person is what we're people are trying to work with there.
Yeah, right on.
Yeah.
Okay, so any other, I know we're like running super short on time. Are there any other, I mean, also we have some time. I'm still working on these in the background, but if you think of other key questions that you think we should include in this first pass, there's like a whole second batch that I think we can do for like concerned community members or explaining homelessness to like the general public. But for right now, I'm really wanting to answer the questions of people who are seeking services. And if they don't know the answer, to your point, Hope, like if they don't know the answer, they're not even going to call. Or if they can't get more information, they're like, well, there's nothing for me, or like I don't want to talk to somebody, so I'm not even going to know what's available. Okay. Anything else about the FAQs? Something in the chat. Okay.
No, I was just throwing out SparkPoint in response to Joe, your question regarding housing, like buying a house resources, because I'm definitely can see how folks would get to that point. And again, we talked a little bit about in youth housing and choice and voice. And so like I'm so frustrated right now with the renting system and trying to make sure I'm actually renting a legitimate good place that I'm like, I don't want to rent again and have to do this again. And versus like, can I figure out how to get my finances to a place where I can just buy or go in with a bunch of people and buy. So those creative housing solutions, I think would be a curious thing to talk about in the future in some place.
Yeah, that might be like the second rung of things, or like if there's some queue, like I might be interested in something else, like that's a good conversation to have with a housing case manager to help you figure out pathways for that. Okay, we have 2 minutes left, and I just want to tell you the things that are left. I don't think we'll get to both of them, but one was I just wanted to, like, these 3 green boxes are essentially what we've said in our work plan that we are trying to do as a committee. So the first one, in our last meeting, we provided some input to governance and funding committees. Just we'll have, as staff, I'm thinking about this, but also in terms of the work you all are doing in other committees and in the COC, like ways that we might be partnering on equity-focused projects or strengthening relationships with partners. So like I'm thinking, we're building a stronger relationship with reentry. Like that's something that we might put in there. Like we've had these presentations from Nicole. We're trying to learn more. So I don't think we have time to really put a lot of input there, but just flagging that to think about for next time. And then I just want to let you know that I've put together the demographics of who's attended our council meetings. We do these little surveys. So I broke it down. Here's each quarter you can see, and then this is the composite overall for each of these things. We have meeting attendance, what's their lived experience of homelessness. This is again for the whole year. Sorry, the graphics were not cooperating. And then race, ethnicity, quarter by quarter, and then composite. And with that, it is literally 4 o'clock. So I'm gonna stop there. We covered a lot of territory today. Iman and Hope and anybody else, for agenda planning for the next meeting, which will be in May, I think I'll reach out to the group and see if there's anybody that wants to be part of that planning process. I'll reach out to you.
Sounds
have-
good. Thanks, everybody.
Great.
Really appreciate it.
Oh, thanks, Hope. Noting that. Okay. Strengthen relationships with people from tenants' rights organizations. Duly noted. I hope your brains don't hurt. That was a lot of information. Take time to digest. If you have questions, you can always write to me and I can help connect you with the speakers, or I'm also going to post all this stuff so you'll have access to it. Be free.
Thanks, everyone.
Bye, y'all.